Connecting Arizona. Live from the 12 News studios at 200 East Van Buren. This is 12 News at 10.
Imagine being home all the time, unable to leave, not because you're not allowed to, but because if you do, you suffer panic attacks. That's what one Phoenix woman deals with on a daily basis. She has a condition called agoraphobia. Aurelia Ortega shows us how this mother of 5 copes and what she's doing to break free.
This is the life most of us live in. Traffic, noise, crowds. But there are some who are trapped in a personal prison who cannot bring themselves to leave their home.
I would say this is the closest thing to prison, minus, I'm not in bars.
For 14 years, 36-year-old Angela Bayer has suffered from a mental condition called agoraphobia.
So severe that people fear leaving their house or going into the public.
If I leave the house, I'm constantly anxious, nervous, always prepared for the worst.
Because of her condition, Angela is not able to work. She and her husband, who's going to school, live off child support and disability. With 5 children ranging in age from 11 months to 15 years old, Angela has missed out on a lot of their activities.
Sometimes I just sit and cry because there's so many things I want to do with them.
The thought of leaving her home to even give birth to her children was so frightening that Angela moved to a place that was a mile away from the hospital. Her children are too young to understand her condition, but they notice her absence.
It's super fun when she plays with us, and it just would be awesome with her being there.
Things were not always like this for Angela.
You name it, we did it. Out camping, hunting, fishing, parties, desert parties.
Her life changed after she was involved in a crash in 1998. The panic attack she suffered stuck with her.
My body just decided to shut down and not live in the real world. I don't know.
Angela had never heard of agoraphobia and did not know what was happening.
When it started happening, I thought I was going crazy. I thought, I was losing it. I didn't know.
The fact that people did not understand, including her husband, made matters worse.
A lot of people, when they hear I have this, they're like, what are you talking about? That's make-believe. A lot of people tell me it's all in my head.
Dr. Michael Yasinski, who treats Angela at her home, says people who suffer from agoraphobia are usually in their 20s or 30s.
It starts with a legitimate reason to have a panic attack, but then it essentially goes to just random, no-reason panic attacks that can happen as much as once a day, multiple times a day.
And little by little, Angela plans to take small steps towards the life she once knew.
My goal is to be able to take my children to Disneyland, because they really want to. But for me personally, for me to be in control, where I can go places and do things for my kids and myself.
Aurelia Ortega, 12 News.
And Dr. Yasinski says that treatment for agoraphobia requires medication and therapy sessions. Usually 12 to 20 sessions are needed over a 1-year period.